If you or someone you know is experiencing vision loss, the first question that probably comes to mind is there a medication that can treat this? It's a natural hope. After all, medicine has come a long way in treating various health conditions. From high blood pressure to mental health issues, medications have proven their power. But when it comes to vision loss, the answer isn't as straightforward. Let's explore what current treatments can offer, what they can't, and where we might be headed in the future. First off, it's essential to understand that vision loss isn't just one condition. It's actually a spectrum of issues that can arise from various underlying causes. Some common culprits include age-related macular degeneration or AMD, often a problem for those over 50. AMD affects the macular, the part of the retina responsible for central vision. AMD can lead to blurry or blank spots in vision. 2. Glaucoma. This eye disease damages the optic nerve, often due to increased pressure in the eye. If untreated, glaucoma can cause irreversible vision loss. 3. Diabetic retinopathy. This is a complication of diabetes that damages the blood vessels in the retina. Left untreated, it can lead to blindness. 4. Cataracts. A clouding of the eye's natural lens, which can often be treated with surgery rather than medication. 5. Retinitis pigmentosa or RP, a group of rare genetic disorders that break down the retina over time. Each of these conditions requires different treatments, and unfortunately, the effectiveness of medication varies widely. What medications can do and what they can't. When it comes to medications, the best outcomes are often seen when vision loss is caused by an underlying issue that's treatable. Let's take a closer look at some of the options. 1. Medications for age-related macular degeneration or AMD. There are two main types of AMD, dry and wet. Dry AMD has no FDA-approved medication that can restore vision loss. The treatment approach often involves lifestyle changes like dietary supplements that contain antioxidants and zinc, which might slow down progression. Wet AMD, on the other hand, has medications that can help. This type involves abnormal blood vessel growth under the retina, which can leak fluid and lead to vision distortion. The go-to medications for wet AMD are anti-VEGF or vascular endothelial growth factor drugs. They work by stopping the growth of those abnormal blood vessels. Some common anti-VEGF drugs are ranibizumab, aflibercept, and bevacizumab. These drugs are usually injected into the eye. Don't worry, doctors numb the eye first. While they don't cure AMD, they can slow down progression and in some cases even improve vision slightly. However, these injections are ongoing treatments, which means you'll need to go back every month or two. Number 2. Medications for glaucoma. Glaucoma is one of the areas where medications has a solid role to play. Since glaucoma is often linked to high eye pressure, medications can help lower this pressure to prevent further damage to the optic nerve. Eye drops are primary treatment. Some common ones include beta blockers, which reduce the amount of fluid produced in the eye. Prostaglandin analogs help the eye drain fluid better, and carbonic anhydrase inhibitors to decrease the fluid production. These medications are effective at slowing down the progression of glaucoma, but cannot reverse any damage that's already occurred. So the earlier the treatment begins, the better. Number 3. Medications for diabetic retinopathy. If you have diabetes, controlling blood sugar levels is crucial, as it directly impacts diabetic retinopathy. The good news is that there are medications that can help. Anti-VEGF drugs, as in wet AMD, used to reduce swelling and prevent abnormal blood vessel growth. Corticosteroids, these can also reduce inflammation and swelling, though they're less commonly used due to potential side effects. Again, these treatments can slow down or manage the condition, but don't cure it. Number 4. Medications for cataracts. Cataracts are a bit different because they're usually treated with surgery. There are some ongoing studies looking into eye drops that might help break down cataracts in their early stages. but nothing has been approved or proven to be a replacement for surgery just yet. Number 5. Medications for retinitis pigmentosa or RP. Retinitis pigmentosa or RP doesn't currently have any approved medications that can reverse or slow down the progression. There is some research into gene therapy and vitamin A supplements, but results are limited. Incoming new developments in vision loss medication. The field of ophthalmology is buzzing with research aimed at treating vision loss in ways we couldn't have imagined a few decades ago. Here are some of the areas where scientists are making progress. 1. Gene therapy. For genetic conditions like retinitis pigmentosa and some types of AMD, gene therapy offers hope. The idea is to replace or repair faulty genes responsible for these conditions. Although gene therapy is still experimental, early trials have shown promise. One gene therapy, Luxturna, is already FDA approved for treating a rare form of inherited vision loss. Number 2. Stem cell therapy. Stem cells have the potential to replace damaged retinal cells, which could restore vision. Although still in experimental stages, stem cell therapy for AMD and other retinal diseases has shown promise in clinical trials. Scientists hope that one day stem cells could help treat or even cure conditions like AMD and RP. 3. Neuroprotective drugs. Researchers are also exploring neuroprotective drugs that could protect or preserve the optic nerve and retinal cells. The idea here is to create a safety net for cells that might otherwise be damaged by glaucoma or other diseases. Although it's still early days, this approach could eventually lead to medications that slow the progression of vision loss more effectively. Number 4. Artificial retinas and bionic eyes. Well, this isn't exactly medication. Some promising advancements in retinal implants and prosthetic devices could potentially restore some sight to people with severe vision loss. These technologies are in the early stages, but they could eventually provide another way to treat vision loss. We made a book, 10 Questions Everyone Should Ask Their Pharmacist. You can find a link in the description below. Feel free to check it out. So, can medication actually treat vision loss? When we think of medication, we often imagine it as a fix. Take this pill or apply these drops, and the problem goes away. For most cases of vision loss, medication doesn't work that way. It can help manage conditions, slow progression, and even improve symptoms slightly in some cases, but it can't cure vision loss. That being said, early detection and consistent treatment are key to preventing further deterioration. If you have a condition like AMD, glaucoma, or diabetic retinopathy, sticking to your treatment plan can help preserve your vision for as long as possible. And of course, future advancements might change the game. With the growth of gene and stem cell therapies, the idea of reversing or halting vision loss is no longer just science fiction. We may not be there yet, but the research is promising. For now, leading a healthier lifestyle is the #1 cure. While it might feel discouraging to hear that medication alone can't fix vision loss, there is still a lot you can do. Regular eye exams are vital because they allow eye doctors to catch problems early. Managing other health conditions like diabetes or high blood pressure can also reduce the risk of developing vision-threatening issues. And when vision loss is unavoidable, there are rehabilitation resources and adaptive tools that can make a world of difference in maintaining quality of life. The landscape of treating vision loss is complex. For now, medications can help with certain aspects, especially if the condition is caught early. But there's no magic pill for vision loss. Research, however, is making strides that might surprise us in the near future. Until then, taking proactive steps with your eye health and following medical advice can help preserve your vision and improve your overall well-being. So while there isn't a defective cure just yet, science is getting closer. And who knows, by keeping up with advancements and prioritizing eye care, we may see transformative treatments in our lifetime. Hey, I'm Dr. V and welcome to my channel. Please check more of my videos about health and medications. and cheers to a healthy life.